Okay, I think we are live. I'll just do a quick check and we are ready to go.
It's technology is always a fun part of doing these things. You never know how it's going to
Okay.
work, right?
Yeah, I think we are live. That's good. Okay, welcome to Namaste Debate. My name is Mani Nair. Today I'll be having conversation with Alvin Tedjo. He was a leadership candidate for the 2022 Liberal Party election, Ontario Liberal Party election, and I will allow him to talk more about himself. Welcome to Namaste Debate, Alvin. How are you?
Namaste. Thank you, Manny. And thank you for inviting me. I'm doing pretty well. I mean, all things considered, we're all sort of stuck at home during the pandemic. So, we're doing as best as we can. We're managing.
Right. So what I will do is I will allow you to say allow you to say all the good things about yourself.
That's a dangerous thing to do when you give a politician or a former politician sort of carte blanche to talk for as much as they can. So I won't take too much time, but I mean, I'll just introduce myself. I'm Alvin Tedjo. I was the one of the leadership candidates that ran in the last leadership election in the province of Ontario for the Liberal Party. I had run before that in 2018 in the riding of Oakville North Burlington, also for the Liberal Party here in Ontario. And that was a tough election for a lot of us. But, a lot of the reasons that I wanted to run and why I also ran for the leadership is that I think it's incredibly important that, we have representation in politics. We have people who are younger moving in and want to have that generational change, people who have priorities that might be a little bit different from those in the past. And so, I live here in Mississauga. I've got 3 young kids. They're now 6, 8, and 10 years old. My wife is a nurse. She works at the Hospital for Sick Children in Toronto. And so a lot of the issues that come up day to day, affect our family directly. Right. Everything that's happening in schools, a lot of the cuts that happens in schools, how hard it was for our family to afford childcare when we had really young kids and they needed daycare before they started school, which is why I advocated for that. And, we've seen all the changes and how much government has an impact on people's lives if they don't have the right priorities. So that's really why I ran in those 2 elections. And, I think we've made a lot of headway with trying to get more people on board with some of the ideas that we put forward. So I'm pretty proud of that, and we'll see what the future holds.
Yeah. No, you like you mentioned your wife, she works in the hospital. For me, I always have the highest regard for people in healthcare and people who are serving in the armed forces, right? The military, who are defending the nation.
Yeah, I mean, we talk about them as essential workers, right?
Yeah.
Because they're essential, right? I mean, they
Yeah.
don't get, they can't take vacation time anytime they want. They always have to work through Christmas and New Year's and holidays as they need to. And my kids over for years have always, wondered why it's so hard for her, right? She works 12-hour shifts.
Mhm.
She works really hard, and it's taxing, and the hours are, you're overnight, you're working on weekends. So she's missed a lot. So it's a big sacrifice. And I think it's important that we recognize that, because we talk about how great, of a service it is for PSWs and nurses and firefighters and everybody to work so hard as they're doing during the pandemic. But, a lot of those people, especially PSWs, they're not supported properly. They're not paid properly. They get paid just above minimum wage. And yet they're some of the most important people in the healthcare system that we have right now. And so I don't think that's something that this government is currently recognizing provincially.
Okay. So that's good to know. So the way we're going to do this is we'll start our conversation talking about pandemic. We'll talk about vaccination. We'll talk about a little bit of social media. We'll talk about federal and provincial policies before pandemic and during the pandemic, and probably we'll end our conversation talking a little bit about municipal policies.
Sure.
So if you're ready, I can start my first question.
Manny, I'm good to go. Let's go.
Okay, thank you. Okay, so my first question in the pandemic section is, how has pandemic impacted your life, and how have you been able to adapt and adjust to the new way of life?
So I work for a university right now, just like you do, and everything's been moved online. So this is now, this was my daughter's bedroom, but it's now sort of my home office.
Okay.
So we've had to adapt to that. But really, I think it's been toughest on my children because we just got back. They were just allowed back into the classroom last week. And so they've been off for 9-10 weeks. They essentially had another summer break, but with online classes, and that's a big gap. And when you add that gap to the gap that they got from the pandemic in the first wave, that's a lot of time that they got outside of the classroom. And as much as educators are trying and school boards are trying to sort things out, it's not the same. Learning online for what was a 5-year-old last year for my son. And now when he's 6, it's not the same, right? It's not the same quality. It's not the same interaction. They can't keep picking up on things when they're not really there, right? And they can just sort of ignore the laptop and go off somewhere else for a little while. So that's been really tough. It's also been tough because they're pretty active. They play hockey, they play baseball, they do dance and gymnastics, they do swimming, and all those things are canceled. So it's really important in their social development as they're growing up to have those opportunities. So the fact that they've lost that is really quite a shame. But we've tried our best when there are opportunities, when we're not locked down. We try to get out obviously safely and keep distance and masks and all that. But there's anxiety there too, right? My oldest son has a bit of anxiety around all of this because all he keeps hearing is the negative news around COVID and all the dangers of that, right? So that's something that I think parents are going to have to cope with, not just now during the pandemic, but in years to come.
Mm-hmm. No, definitely, it's a bit not easy for, especially of course it impacts everyone, but mostly small kids, because they need social connection, friends, playing outdoors, all those things. It has definitely impacted them, and like you said, online education is not the same as in person, class session, right? To some extent, online helps, but hopefully things get better as we move forward. So my next question is, what is the worst outcome of this pandemic? Of course, we know a lot of deaths have happened, but other than that, if you want to talk about that, some of those things you already mentioned, but if you want to elaborate more, you're more than welcome. And what is some of the positive things you see coming out of this outcome, out of this pandemic, basically?
Let's start with the positives there, because there are some. I think the positive thing is that, generally speaking, when the pandemic started, the majority of Ontarians, the majority of Canadians, I believe, had the right attitude. We need to take care of each other. We need to protect each other. We need to keep each other safe. We can't let people fall through the cracks. That isn't just for their health and well-being, but also economically, we need to support people. I think the CERB was a huge step forward, and having the country come together and say this is important. People need the basic necessities of life, and it's important that we provide that. I think things have changed since then. I think it's been politicized much more in the last few months, and you're starting to see, people pointing the finger and blaming and trying to second guess, what was the right thing or not the right thing to do. And I think depending on if you're talking about the federal government or the provincial government, there's a lot of lessons learned there, right? I think federally speaking, the federal government, right off the bat, I think they tried to do everything they could. And then the question starts to come around the vaccine now, and we're going to talk about that a little bit later. But the question keeps coming back to what else could they have done at this point? Mm-hmm. And then provincially, you look at the fact that the Ford government, I think, reacted appropriately in the weeks and months immediately after the outbreak. Mm-hmm. But since then, I think they've been completely irresponsible. Right. Mm-hmm. They had a study done last summer. They knew what needed to be done and changed at long-term care centers. They knew, and they got reports about what needed to be done in high schools and elementary schools to provide safe learning environments. They knew all these things. They knew that businesses needed support, and they didn't do any of them. right? Like they didn't implement any of the changes in long-term care facilities that they should have been doing. They didn't add any new staff or any new physical space for schools to keep kids safe. And they didn't offer any business supports until about a month ago. And most of that from money that they're getting from the federal government. So, there's a huge failure of leadership there where they claim to do the right thing by just saying they're doing the right thing, but not actually acting on it and fulfilling their promises. So, I think that's sort of the biggest negative. And you can't let go of the fact that we know that they could have done things differently in a certain way, and that somebody told them that they could have done things differently and they decided not to. And that ultimately led to more deaths than you would say is necessary, right? Especially in long-term care homes. So I think that's easily the worst outcome out of all this.
So on the positive side, how do you see, like I see technology is playing a very active role in terms of, and a lot of positive thing coming out of it. Do you want to talk on that?
Yeah, I mean, it's good that people are, developing their skills online and that things are growing in this space. But that's also a risk, right? I mean, it's good that all workers may not necessarily have to work in person anymore. But that's limited. That's limited to a number of, white collar jobs. You have a number of blue collar jobs like my wife who still have to go into work physically every day when they are supposed to work. And they're still at risk. And, we get food delivered by delivery people who go to the grocery stores for us or go to the takeout place for us. I mean, they're still putting themselves in danger. Right. And more often than not, it's racialized people, it's visible minorities, it's immigrants and newcomers coming to Canada who are doing these jobs that we consider essential, but that we're not supporting them in a significant way. Right. We expect them to do all these things and take all this risk without, any better compensation, and other people are sort of profiting off of that. So I mean, it's good, but it's also exposing some bad here, and some people are being taken advantage of.
The one other good thing I see is less cars on the road. That is good for environment.
Yeah, no, for sure. And I think they said that 2020 was one of sort of the best years in reduction for carbon emissions because people stopped driving, and I think some energy use went down significantly. So yeah, I mean that's a good thing, but it's temporary, right? I mean, when this is all done, how quickly is that going to go back up to was and past it? So
I think right now people would be, after vaccination, probably people would be very desperate this summer to go out and travel. It will be interesting.
Well, hopefully they decide to travel in the country or in the province, and they can see other things, and I think that'll be good as well. Good for our economy, and good for the environment as well. Not to go too far away, but yeah, you're right. People want to get out there. I read in the paper the other day that Ontario Parks is almost full for July and August already, because everybody wants to get out and everybody wants to go camping and all that. So I mean that's good. That's good that we personally, a lot of people took more attention to their health, right? They went out for walks a lot more. They were exploring their environment a lot more because they weren't sort of, either chained to the desk or stuck the way they used to be, right? So they got out of their cars. So that's all good.
Okay, good. Okay, my next question is, we talked a little bit about pandemic. I want to talk on the vaccination. So my next question is, do you think Canada is doing a good job when it comes to vaccination rollout?
So, I mean, it's a complicated question because, you want to get to the fact that Canada does not have its own domestic supply, right? And why doesn't Canada have its own domestic supply? Well, the Harper government several years ago, decided they didn't want to keep subsidizing pharmaceutical companies for operations in Canada. I don't necessarily disagree with that, right? Why should the government be subsidizing these things? There is, maybe obviously some Monday morning quarterbacking where you could say, well, if we had that capacity, maybe we could do some of these things in-house. So some of that should be considered as well. But I think what you need to look at is you need to look at what were the cards that this government was dealt immediately as it happened. Could they have gone back 10 years and changed those policies? No, they couldn't have. Could they have done something differently in the last 5 years since they've been in power? Yeah, probably. But they didn't know that this was coming, and maybe they should have prepared more for it. But the fact is they didn't. So what could they have done in the immediate situation? Well, they tried to buy as many vaccinations as possible from as many different suppliers as possible. They basically threw hundreds of millions of dollars to buy as many vaccines, so that each Canadian essentially has up to 6 at this point, right? If all those things get put through. But we also have to understand that paying for those vaccines early helped to the development of those vaccines in the first place. Right? They had to do research, they had to do development, they had to do testing. All of that needed to be funded, and they needed to be funded by federal governments across the world. So we contributed to that. Now, some of that helped us get, early numbers, but not in the quantities that we want. And a lot of that was out of our control, and a lot of that was out of the manufacturer's control, because they're just like us, scrambling to do as much as they can. So could it have been a little better? Of course, everything could have worked out a little bit better, but I don't blame this government for trying and for really trying to secure as many vaccines as possible, to the point where we have more than we'll ever need when we eventually do get all of them. But, at the same time, we're trying to introduce a domestic production stream, and we're trying to, create as much PPE domestically as possible, so that if and when this happens again, we'll be more prepared. But for now, and for the immediacy and what was put in front of them, I think they did as best as they could.
Regarding the PP, I just wanted, because before I may forget this, but I just want to bring it now, because in Waterloo region we have one company called I think it's the Canadian Shield Company. So I think yesterday, day before, they had to lay off more than 40 employees from the company, and the reason the CEO actually gave was the hospitals here, they have an agreement for 7 years with importers. So the hospital won't even take PPE. They can't even buy PPE from local manufacturers, and I was very surprised because of the 7-year agreement they have with the importers.
Yeah, and the tricky part there, Manny, is that in the middle of this pandemic, when the U.S. president was still Donald Trump and wanted to take all of the PPE that was being created domestically there in the United States and not ship any to Canada either, that's part of the problem, right? Is that, you have these contracts with these large manufacturers who can produce at scale and probably be a little bit more affordable than what you could produce here domestically. But then what's going to happen in a time of need, and you have a government, foreign government, who can control your supply? That's tricky, right? And if you don't keep those people employed in Canada, how do you ramp up production if and when you need to? So that's really tricky. And I think the federal government knows that they need to do more, especially with the stockpile. There was a plan years ago in terms of how to best prepare for a pandemic. So I think they need to revisit that and maybe intervene and maybe use as much of that as they can to create the stockpiles that we need.
Thank you. My next question is about the vaccination. So how confident are you with the approved vaccination and its effectiveness?
Well, I mean, they did trials with tens and tens of thousands of people, so I would assume it should be safe. My wife has taken both her doses already. She got one in December, another one in late January, early February. So she should be fully vaccinated by this point. I think what's fascinating about it, and what I encourage everybody to look into more, is how these vaccines are different from the traditional vaccine, right? The mRNA type of vaccine that's been created is a completely new type of vaccination technology, right? And it's fascinating when you look into it and you understand that it actually is a safer way of doing it, and could be, much more effective than the traditional way. So, while it might be somewhat unproven, scientifically speaking, I think the numbers are there to support the fact that it will work. But we need as many people as possible to take the vaccine. Otherwise, we won't, reach our herd immunity, which is so important, and the people who are vulnerable will continue to be vulnerable.
Yeah, today I just came to know that somebody I know in India, he was part of the initial trial vaccination. So he took the trial vaccination probably around October of last year.
Hmm.
And so today I learned that he was tested positive. So he's not sure whether it's a new variant or the old, but he has to do two tests. One test said negative. The next day he did another test from another place, and that tested negative. So he's feeling okay. He lost the, he doesn't have the taste to eat. He doesn't smell anything. But interestingly, he took the trial vaccination. So one thing I'm not sure is there are different 4 or 5 manufacturers. That's why I asked this: what is the effectiveness? Only time will tell. Like, it
Yeah,
depends.
and they're not all effective to the same rate, right? I
Yeah,
mean, some of them are 95% effective, some of them are 85% effective,
yeah,
and they're effective after the first dose, enough to help a lot of people, but you kind of need that second dose and all those other issues that you have there. My father was actually diagnosed with, or he caught COVID-19
okay,
late last year. He was okay. I mean, he had a couple of rough days,
right,
but he did all right. But he and other healthcare workers will certainly, I think, take the vaccine because they know how important it is. And I
right,
think that needs to be the conversation that we have publicly: is everybody needs to get their shot once we
right,
get all the vaccines.
right. I think one thing a lot of medical professionals are saying is, at least with this vaccination, the chances of you getting hospitalized will be far lower than not taking it, right? So I think that is a good thing. The only one major thing we want to prevent is hospitalization, right? We don't
Sure.
want,
Yeah.
right? Okay. Okay, good. My next question is, what do you think? Like, how long will it take before things go back to normal pre-COVID-19?
Completely normal? I don't know. I mean, I was old enough to remember after 9/11
Mm-hmm.
how things changed essentially
Mm-hmm.
forever,
Mm-hmm.
right? And I think some things will change habitually in people forever after this. I
Mm-hmm.
think normal to the point where people are going out to restaurants and going out to games at full capacity. I think at some point in 2022, that'll probably happen. We might get close near the end of this year, depending on how much people are vaccinated. I think, by the end of this year, we'll probably have gyms open and people will be able to go out and dine, and the lockdowns will probably end. But I don't see I don't see it completely being lifted in terms of restrictions. I think you'll probably still have, limit to how many people can be around each other. The schedule right now, federally speaking, is that they're planning on getting all the vaccines by the end of September. So, let's give them a month or two to buffer that.
Right.
You have to include some time there for the provinces to actually put those shots in people's arms.
Mm-hmm.
Um, and then you have to convince the segment of the population who are weary of taking a new type of vaccine, who might not want to take it right away. So how long will it take before you actually get to, full herd immunity, before you're comfortable completely lifting all restrictions? I think that might be a while. I know that several universities have already said, like the University of Toronto has said, that they're not going to have in-person learning until January 2022. Some other universities, like Ryerson, I know they're still sort of holding their breath, saying end of August for sure will continue to be online, and they're still waiting on September. Some people are more bullish on that. I was talking to some other colleges out west who think they can get back in September, but
Mm-hmm.
I don't know, man. That's a tough one to sort of predict.
Yeah, I think in terms of vaccination, like you said, I think if we have a national portal for registration for the vaccination, would be nice. I think right now the Waterloo region we have the registration portal now, so people who are above 80 can go and register themselves. I think
Yeah,
yeah.
yeah. I mean, there's going to be a provincial portal. I heard it was March 15th, which
Mm-hmm.
is in a couple of weeks. But you have several other provinces already out ahead now,
Mm-hmm.
their portals. So I mean, you need a central government there coordinating all of this,
Correct.
because
Yeah.
and
That
tracking.
will, yeah. So that will get us some information, right? How many people are passionate about getting vaccination? The other thing is people, let's say people are reluctant to take vaccination. One thing the government can give is incentive. So let's say the government says, okay, if you get vaccination next year, we'll give you some credit, income tax credit, or some sort of incentive will also help drive the vaccination also.
I mean, that's an interesting idea. I don't know.
Yeah.
I don't know if they're going to be able to do that or not.
Mm.
Yeah,
Because the economic impact is more, right? Let's say you give $100 credit if you take vaccination, or $500. The cost of giving that is far lower than economic impact. I think the more people get vaccination, we can start moving with on the economy side, right?
right. Yeah, I mean, interesting idea, and
Yeah.
we'll see how much more incentive people will need to actually get the vaccine.
Yeah. So only after registration, we'll know like what the numbers look like, right?
Right.
Once we have the initial numbers, then we know what percentage of people are willing to get vaccinated, right? I think generally they say the success rate for vaccination is, if you have 60% of the people vaccinated, that's a good rate, right?
Yeah, I mean, you might not get to that herd immunity that you need, and some
Yeah.
people are vulnerable. But if you've targeted those people, what's interesting is that I've read a couple of different things. I know in Indonesia, where my parents were from, they're ethnic Chinese Indonesian. They were doing the reverse. They tried to, or are vaccinating the super spreaders first.
Okay.
In their 20s, 30s, 40s, and 50s. They're targeting that part of the population first because they're the ones who are going out and
Correct. Yeah.
spreading the disease.
Right.
So immunizing them first is kind of an interesting tactic, and we'll see if it's successful or not. Versus what we were doing, which is starting with the most vulnerable, but not completely. I mean, the federal government allowed the provinces to decide how they were going to do it. In December, the provincial government had the opportunity to vaccinate everyone who lived in a long-term care home.
Yeah.
They didn't. They decided to spread it around. They did some at long-term care homes. They did some for frontline workers. And that's an interesting decision because that you could have vaccinated everyone in a long-term care facility by the beginning of 2021, and by the time you actually did, which was just a few weeks ago, there's a gap there where you could have vaccinated someone, you decided not to give it to somebody else, and people died. So that's a tough decision to make, and I'm not sure it was the right one.
I think moving forward in the election, it'll be interesting time. But see, this is the issue. So let's say we ask the federal government why you didn't this way. They can always come and say we could have done this way, but we thought this is the right way. Ask the provincial government, they will do the same argument, right? The question is, what is the right way? Everybody will try to defend themselves. Looking back, we could have done this. So I think all political parties will play this rationale, right?
Yeah, they're going to try. I mean, the thing is that it's easy to look back and say you made the wrong decision, but at the same time, I think it's fair to criticize governments who had the information before and knew what was going to happen based on those decisions, right? The Ford government ignored a number of the recommendations that an expert panel gave them to make long-term care homes safer. They ignored it. They didn't implement all the solutions that were proposed and all the recommendations that were proposed because it cost more or whatever it is. They didn't want to do it. So that's a conscious decision they made, and they should own up to that.
One good thing about what happened during a pandemic is that at least the provincial and the federal government didn't fight with each other. So that was a good thing for me.
It's good that they were collaborating for sure. But, there are going to be continued political fights and finger pointing and blame assigning
later on
over the next couple of elections, right? I mean, we're probably going to have a federal election at some point in 2021. And we're definitely going to have a provincial election next year. So all these things will be second guessed. Okay,
good. Okay, my last question under the pandemic is, what would be the first thing you would like to do once the pandemic is over?
I want to take my kids out. I want them to, go to Canada's Wonderland. I want them to, go to a restaurant. I want them to see their friends, play games. It's less important for me in terms of what I get to do. I've thought a lot about how this last year has, been a gap in their development. I couldn't imagine I can't imagine how this is going to impact them moving forward, and how this would have affected us when we were kids, essentially losing a year or having a year lost to a pandemic like this where nothing was normal, right? So
Okay, good. Okay, so we covered pandemic, we covered vaccination, we covered a little bit about life before pandemic and what the life you want to have after pandemic. My next question is related with social media. So right now everybody is on digital platforms, Facebook, Twitter, so many things happening. You have freedom to express whatever you want. So my question is, currently on social media we are seeing an increase in hate messages being posted. Do you think in the name of freedoms of speech it is acceptable? What is your take? What people should say or not say?
I mean, yes, you do have the right to freedom of speech, but there are limits. You can't say anything. You can't say anything you want. We have hate speech laws here in Canada. And that's, a lot of this is really troubling for me in terms of what's been going on there on social media. In British Columbia, there's been a lot of reports of violence against Asian Canadians, Chinese Canadians specifically, which I think is just awful, right? I mean, Jeremy Lin, who plays in the NBA, well, he's in the G League right now, but he was called coronavirus yesterday.
Oh, is it?
Yeah, and so it's persistent. It's rooted in racism, obviously. There's this yellow peril phenomenon that people have thought of for hundreds of years. No one is throwing out people from England or South Africa or Brazil because of the variants coming from those countries. But they're, pushing over 85-year-old women on the streets of Vancouver because there's real hate and fear there, right? And they want to blame someone. So it troubles me quite a bit. And I think social media has amplified a lot of these thoughts that people have. It's given them a like-minded community in which they can interact with and share and fuel their biases and their bigotry, right? So I don't think that's healthy. So much of our social media conversation is done in an echo chamber, right? I mean, I've got 10,000 followers on Twitter, but how many of those people disagree with me?
Correct.
I don't know. I mean, I do get negative comments depending on what my posts are, but generally speaking, you're speaking to other people who follow you because they agree with you, right? So we're not talking to each other, and we get that confirmation bias over and over again from the people who do agree with us. And so you get the wackiest thoughts and conspiracy theories confirmed over and over again, and it's dangerous, right? You have an MPP right now, Randy Hillier, who's completely office rocker, who says the whole thing is a sham and that people shouldn't be wearing masks, and he's an elected member of provincial parliament. You get people like Derek Sloan and people who believe in conversion therapy and who don't believe in women's rights to choose, and all of that, it gets amplified by social media, and people think there is a real audience with this because there is one, because they're finding each other on social media versus 10, 20 years ago when they would just kind of be having these thoughts themselves.
Okay. So based on what we saw in the US and I'm seeing in other parts of the world also, do you think social media platforms should be suspended 1 month before election to reduce the impact of fake news and propaganda on voters?
I don't think so. I think Facebook and Instagram, I mean, they're the same thing. And Twitter, I think they knew how much their platforms were being used from the previous election in 2016 for the US, and that their platforms were being used to spread misinformation. So I think they knew they had a responsibility to take care of it in some way. The problem is, Manny, is that if you completely cut it off, you're also cutting off the opportunity for people to interact with each other, to talk about the election in a factual way, right? We should be able to have open and fair discussions around what the best policies are and who the right leaders are for the country or for the province. So, I think that's a drastic step, but I think if the platforms are responsible, they'll do what they did in the 2020 election in the US, and they'll do more of it. They'll be monitoring, and I'm not sure that it's their job necessarily to be a fact checker, but there's a line that they need to create that states when it turns dangerous, when someone's inciting violence against a group of people, we can't stand for that because they're enabling that, right? I mean, the world seems so much quieter once Donald Trump lost his Twitter handle, right? So, I don't know that you can sort of cut off completely, because I think people still need the opportunity to talk to each other, and they're going to find another platform. Right. Ultimately, they'll go into another corner of the internet. They'll promote something else, and then that'll be the new thing. And they'll be less prepared to deal with monitoring and the consequences of that. So, that's really tough.
The other way to do is geographical based. So let's say there is an election in US or Canada. So when there is an election, in order to reduce the foreign interference in terms of fake news or propaganda from foreign players, you could actually restrict the social media to that geography itself. So anybody.
That's a great idea. No, that's a great idea, Manny, because I mean, that would be tricky in terms of how you would make sure all the IPs were domestic, and because some of them could get rerouted, and there's a lot of technology back there. I think it's a good idea in terms of trying to reduce foreign influence, and I don't think we're taking it seriously enough. I think in Canada, we could easily be influenced through social media during our elections, and we haven't prepared for the potential consequences of that. Now, I think our electoral system is much cleaner, much more fair, much more straightforward. As someone said, you can't hack a pencil and a piece of paper. I do think we should be looking at ways to have some electoral reform to get more people engaged and give people more access to the vote. I think we massively need to increase mail-in ballot opportunities for people. And I think it's something that is certainly at risk if we're not paying attention to it. So,
okay, good. Okay, so that's all I have on the social media. That's all. Yeah, social media. These are the questions. Okay, now I want to switch gear and I want to talk about national and provincial policies. So my question under the national level is, what's your take on the Trudeau government so far? How would you rate them 1 to 10? 10 means they are doing an extremely good job. So far, what have they been able to achieve and areas they can focus more and improve?
I mean, I think on the overall, I'll give them an 8 out of 10 to answer your question. I think on the pandemic, I think they've actually done the best job they could have. I don't think you could have expected any other government to take it as seriously, to move as quickly, to put in as much money into this as possible, to not only protect Canadians, their health and well-being, but also to protect the economy and to make sure that the phase that we're in right now in terms of the recovery is going to be as smooth as possible and that we can grow from this, right? I think on the pandemic, I think that's 10 out of 10. I think where they've maybe not had the opportunity to do more is around some of the things that they talked about in the last election, right? I mean, they wanted farmer care, and I think people know that it was a priority in the last election. They haven't had a chance to do that yet. I think they need to show progress on it. Otherwise, it'll seem like an empty promise. I'd like to get to a point where farmer care, eye care, dental, these feel like things that should be part of our healthcare system and not necessarily funded by the private sector for people who are employed, right? I mean, there's a huge gap there for people who are not. So I think universal pharmacare is certainly a good step towards that direction. I think CERB was an excellent opportunity to demonstrate that an economy can thrive and survive with essentially a universal dividend, right, where people were getting money. And so I've been a huge proponent for universal basic income. And you could argue that the CERB was a version of that, and especially to the enhancements to the Canada Child Benefit as well. And so I think that's an opportunity for this government to push that even more. There's a bill in the House right now written by a Liberal MP, Julie Dershowitz, which I support. And I think it gives the finance minister an opportunity to find a way to support a guaranteed livable income here in Canada. So, I'd like to see more progress on that before we get to the next election.
Yeah. Now, regarding the guaranteed income, my previous thought, because I think I read research which was done somewhere in Scandinavian country, was what they found was by giving the guaranteed income, it made people happier, but that doesn't mean there were more people willing to get into the the employment area. So a lot of people felt comfortable getting the money. But now, after the pandemic, I feel I'm more supportive of the guaranteed income. But it all depends, how much people will get. And I hope once people start getting, and I hope they still feel motivated getting back to the workforce. So that
They
is
do.
my.
So, Manny, there are two examples that I want to talk about really quickly on this.
Okay, sure.
Right? We had the Ontario Basic Income pilot, which Doug Ford canceled after he promised he would keep it. And we had the Mincome pilot in Manitoba a couple of decades ago. And what this showed, because there's been studies after the fact for both those pilots, is that the unemployment rate didn't change. Sometimes it went up a little bit, but it never went down. And what changed was that right now you have people who are living below the poverty line. Nobody wants to be poor, right? Nobody enjoys being poor. Everybody wants to better themselves, right? No one is looking forward to live off of a government check. That's a fallacy that conservatives have talked about for generations. Nobody wants that. No one's going to sit down on their ass for $1,400 or $1,700 a month. That is not enough to enjoy life. What it's enough to do is provide you the basic necessities of life, right? And to supplement your basic necessities. You can't live on that in downtown Toronto. Maybe you could live on that in Hamilton or Thunder Bay, but it's enough to help you to supplement your income, to pay for some of your rent, and to provide you enough food and water, right? If you don't do that, what are you relying on? You're relying on the system to support people who don't have the ability to keep themselves up, right? And what that means is not everybody can lift themselves up by their bootstraps, right? Not everyone has boots necessarily to do that. That's a line that I'm taking from Senator Hugh Siegel, who wrote a book on this, on basic income, which he's supported for a long time. So conservatives, New Democrats, liberals, Greens, a lot of people in a lot of parties support this idea because they know that it actually costs the system more than a basic income would by not having one. So what I mean by that is, my wife works at a hospital. She used to work at a community hospital, which was kind of in a rough neighborhood. And every night there'd be people who come in who don't need healthcare, Manny. They don't need healthcare, but they make something up so that they can stay inside because the shelter is full and there's no more food at the soup kitchen and they don't have any other options. So they walk into the hospital and they use a hospital bed, right? That costs the government thousands of dollars. And essentially what they needed was shelter and food, right? There's a phenomenal article written by Malcolm Gladwell that talks about the $1 million man, the $1 million homeless man in Phoenix, Arizona. His name was Murray. And they call him the $1 million homeless man because when he died, his social worker, his parole officer, they all came to his funeral and they, had a meal together and they said, do you realize that this government spent over $1 million on this homeless man, but we didn't help him because we never gave him the money. We tried to put him in certain places, put him in certain programs, and it didn't work. Right? Sometimes people just need a little bit more and they need to know that once I have this security, then I can think about what I want to do next in my life. Right. I met a lot of people who were on the Ontario pilot who said, I worked 3 part-time jobs at minimum wage, and I couldn't get out of poverty. You know what the basic income pilot did? It let me quit the jobs that were terrible, and I could work harder at the job that was good, or I could start my own business, which I know somebody did. In Manitoba, we saw graduation rates go up for families who were part of the program in school. We saw healthcare hospital visits go down by 8%. 8%. Which, if you multiply that over an entire province, would be enormous in terms of the value of that. And lastly, we saw domestic violence go down by 44%. Domestic violence went down by 44%. Think about that, Manny. Think about the fact that people fight, families fight. Nothing is appropriate. There is no excuse for domestic violence, but it happens more often than not because of financial constraints. Right? And we're not talking about giving people thousands and thousands of dollars. We're talking about bringing them up to the bare minimum to stay alive. Right? It's indexed at 75% of the poverty line. Right? It doesn't even get them to the poverty line. I could talk about this forever. So
I think in general everybody would agree, helping each other. But ultimately the question comes to the income tax, right? Well, will it get will there be an increase, and which tax bracket it'll be impact, all those things, right?
Well, it's a self-fulfilling prophecy, right? Like you give people, you give someone who has no money, right, $100 or $1,000. They're not going to put it away. They're going to spend it right away, right? They're going to spend it on food. They're going to spend it on clothing. They're going to spend it on shelter. All of that goes back into the economy. You give, a millionaire a tax break, it goes into a second yacht or another cottage or whatever it is, right? Or it goes into the bank, right? It doesn't do anything to help everybody. You give, you give money to everybody who lives below the poverty line, and suddenly all that money is reinvested in the economy right away.
Okay, quick time check. So we probably have another 10-15 minutes. I quickly want to cover, what is your take on the Doug Ford government? Same question, 1 to 10. 10 means extremely good, 1 means not good. And what are the good things they did, and what are the things they could improve?
I mean, I think the Ford government's at like a 3, to be honest with you. I think for the first 3-4 months of the pandemic, I would have given them an 8 or 9 or maybe even 10, right? I mean, they were reacting. And in that scenario where they were reacting to the realities of the pandemic, I think they did the appropriate actions in the first couple of months. They shut it down. They, put people online. They put in restrictions. They tried to get in as much PPE as they can. I give Doug Ford credit for doing that. And then suddenly it turned into a show where he was saying all the things that he knew he needed to do, but he wasn't actually doing any of the things. And so, you can blame them for not having inspectors or for cutting the amount of inspections at long-term care facilities from, a few hundred a year to 6 or 5, which is insane, right? But, that's hindsight. The fact that he continued to do things the wrong way after knowing they were the wrong things to do and not fixing it is appalling, right? They have to take all the blame for that. And let's not forget, in the first year and a half of this government, they were doing all sorts of terrible things, right? They took out the free tuition program for post-secondary students. They cut funding to high schools and elementary schools. They attacked healthcare. They tried to privatize certain things. They attacked workers by taking back sick days. They still haven't brought back sick days, right? I mean, how crazy is it that we're still in the pandemic and we're almost exactly a year in, and they haven't reinstated the sick days that they took away, right? They said, the federal government will deal with that. We don't have to do that, right? So then what's the point of what it is that you're doing here? What are you actually trying to accomplish, right? So I think this government is very irresponsible. They're self-centered, and they are just, full of BS in terms of trying to say what they think people want to hear without actually doing any of the work. So, they're still sitting on billions of dollars that were provided to them from the federal government for COVID relief, and they're not providing it, right? They said they were going to give PSWs a minimum wage increase. And it took them months to get to that point. It just happened. they were going to provide pandemic pay for frontline workers, for nurses in the healthcare system. I can tell you that took like almost 8 months, right? So, I'm very disappointed in this government. I'm very weary of how much they're continuing to ride their earlier success and doing the right thing. I mean, his polling numbers went through the roof because everyone expected him to fall on his face, and he didn't. He did the basic human thing to do and had the right response that had decency in it, and that was quick and affirmative, right? And that's great. But now, the rubber's hit the road, and there's more than enough evidence that this is a government that's incompetent and incapable of doing the right thing at any given time.
So you rate them 3 to 10? 3 out of 10?
That's generous, but I
be
mean,
interesting election next year.
The province hasn't completely fallen apart, so I guess there's some credit there that they're not doing that much damage. I'm sorry, I missed that last question there, Manny.
The next year there's an election. It'll be interesting.
Yeah, June 2nd, 2022. Mark it on your calendars. It'll be an important one.
Yeah, it'll be interesting. It's hard to tell right now. Like you said, and I agree. Initially, I was very supportive of the Ford government, and then later on things started falling apart. I agree. I'm on the same page. I time to time I tend to give my opinion. Like today, if there is an election, who would I vote for? Right now, provincially, I'm inclining towards Liberal, but I haven't totally made up my mind. So far, it's the compass is in the middle.
Yeah, I mean, I'd encourage you to vote Liberal. I mean, we've got a good slate of candidates, and we've got a leader who's been there before and understands how government works, right? I mean, Doug Ford came into provincial government with 4 years of experience being a municipal councillor. Didn't know how anything worked. Thought he could just dictate everything to everyone, and they were settling scores all over the place. His chief of staff, Dean French, was just running roughshod over the house and doing whatever they wanted to do. And it wasn't good. I mean, that's not a healthy way to run a democracy. Right. And so, yeah, I mean, I hope for all our sakes that, he's learned a little bit more and we'll get to a better place, but I'm not going to hold my breath for it.
I think there's an opportunity for them to change things. I feel because people always have short-term memory. Like you said, the elections in June. So let's say if the vaccination rollout goes very well, both the federal and the provincial government will take credit for it.
That's true. Yeah.
Right.
Yeah, I think if it doesn't go well, I don't see the federal government going to an election.
Yeah, exactly. But I think if the vaccination goes well, then it changes everything. People don't. They only have short-term memory, not long-term. What happened 1 year back? They only look for what happened in 1 month or 6 months back.
Yeah, for sure.
Okay, so time check. So we have probably another 5 minutes, 10 minutes. So I just want to quickly stay on the province, but I just want to talk about, because I was reading about you and you were very passionate about during your leadership. You were very passionate about merging the school board, the general public school board with the Catholic school board. Personally, I strongly support that. And I know there is statistically, a lot of people think that it should be merged. But like you mentioned, behind the scene, there are a lot of, people are reluctant to do that. If you want to talk about that, you're more than welcome to do that.
Sure. I mean, let me start by saying, this is a personal opinion. I'm Catholic. My wife's Catholic. My kids go to Catholic school. My wife and I both went to Catholic school. We're not trying to attack the system. I think what we're trying to do is, highlight the fact that the system is inequitable right now. My wife has French language rights. So we have the choice of 4 different schools and 4 different school boards to send our children to. That's not true for the vast, vast majority of Ontarians who are either only English speaking or non-Catholic. So it's not fair. It's not equitable that we have one system we have a system that discriminates openly against letting certain people go to certain schools. I will say that this is not the party policy of the Liberal Party of Ontario. This was a proposal that I put forward in the last leadership race. I didn't win, so it's not adopted by the party. Although there are people in the party who do support it, and there are people in the New Democratic Party who support it, who supported Michael Prue when he suggested that when he ran against Andrea Horwath. There are people in the Conservative Party who supported it as well. And in fact, 2/3 or 3/4 of Ontarians in 3 different polls that came out during the leadership race support the idea. Now, there's also low motivation to do it because there's no impetus to have this happening right now. It happened in Quebec. It happened in Newfoundland and Labrador. It's happened in Manitoba a long time ago. But, you had provinces who had much more religious systems go to this because they saw the need for a secular system. And especially in Quebec, it's much more Catholic than Ontario is, but they had a secular rise in their society, and this was part of that movement. Now, what we want to do is what I was proposing at the time was by merging the boards and giving everybody the opportunity, including teachers and education workers who weren't allowed to work at a Catholic school if they weren't Catholic, which is the only place in this province where there's a religious test for where you can work in for the government and in the public sector. But we also wanted to open it up and make it more diverse, right? I mean, when I was in school, we had world religions and we learned all about everyone else's cultures and religions, and that was fantastic. So why don't we have that as an option for people to take while they're in high school, right? Like give that option to every student out there, regardless of what their background is, so we can learn more about each other. We live in an incredibly diverse place. We should be celebrating each other's heritage. And I think that was, what we were trying to do. But ultimately it came up as well because Doug Ford was cutting the education system. So any savings that could potentially be found by merging boards and merging schools, a lot of that would be seen in the north and rural Ontario, where they would have the opportunity to keep schools open because they would have more numbers. And you wouldn't have people, busing by schools all the time and into other communities. But any savings would go back into the classroom to pay for more teachers, to pay for more special education, to pay for more resources, to keep class sizes down, right? Those are all good things that this government has sort of forced us to look at. But another one, Manny, that I want to talk about really quickly that's related to education that we proposed was universal childcare. For a couple of years, I will tell you, my wife and I paid $38,000 gross. We paid to have 2 kids in daycare because I worked full time and she worked full time, and we lived in Toronto, and that's the going rate, right? $19,000 each for a kid a year to go into daycare. So, I thought it was really important that we built that bridge. And in the last election in 2018, provincially, I was, very happy to support Kathleen and be a candidate for her because she proposed, we extend childcare to start at, 2.5 years, basically adding another year to the beginning of a person's, a child's education. Right. And so I said, let's fix the gap. Let's get that gap all the way out there from, a year and a half when someone could potentially finish their leave, the parental leave, and provide that universal childcare from that point on for people who need it or want it. Right. It would take a long time, but people show studies have shown huge results from investing in childcare, especially for women. Right. Giving women that opportunity to be in the workforce if they so choose. Right. And not being sort of discriminated against because they have to provide childcare. It would create tens and tens of thousands of jobs and add billions to the economy. I'm, really looking forward to more parties provincially and federally talking more about childcare, because it's a period of time in parents' lives that they struggle with so hard. And then after, 4 or 5 years, and when you're done sort of having young kids, you move on. But it hurts you a lot during those years that you have to put it up with. So put up with it. So I think that's something we definitely need to help families with here in Canada.
Yeah, I strongly agree on that. Childcare is outrageously very high, and it's also not helping a lot of, especially the moms, to basically join even the workforce because it's so expensive, even for one child, right?
Yeah,
It's
it's unbelievable. And I
yeah,
mean, there's this assumption that women are the ones who do it. And, I do a lot of the parenting myself, but
mhm,
so, it will help fathers as well. And it will help both parents have more
yeah,
responsibility and, share in the responsibility of that. And, I think, it's something that's well overdue in this country. And we've been talking about it for decades. But we haven't been able to do it.
okay, good. Okay, so my last question is related with municipal policies. So I don't know how much you know about Waterloo region. Here we call it Tri-Cities: Waterloo, Kitchener, Cambridge, and our bylaws are different. And like in Waterloo, people cannot even have fire pit behind in the backyard of their houses, but in Kitchener and Cambridge they can have. So rules are inconsistent. I think this is the same thing probably in Peel region and other places. Do you think having a unified one bylaw for a region it's helpful?
Yeah, I mean, I know you have local municipal governments, but you also have a regional government.
Yeah.
I,
Like Peel region is also there, right? In Peel region you have Mississauga and other, yeah.
yeah, and there are some bylaws for both. I think you have local laws that need to, or local bylaws that need to be come
Mhm,
up by the local politicians, and I think
mhm,
consistency is helpful in certain cases.
mhm,
But I still leave it to each municipality to sort of decide what's best for their constituents. I know here, I think we can have a fire provided that we're cooking something. So
mhm,
it could be marshmallows, could be hot dogs. And I think that's a way to do it, right? I think there's probably fear around, fires and stuff like that. But I think if you want to do that, then you advocate for it and you talk about there's a need for education
mhm, mhm,
for residents as well. It's not just okay, go ahead and have a fire wherever you want. There's
mhm,
whenever you walk into a provincial park, you can see the
mhm,
meter in terms of how dry it is or how safe it is, and they'll tell you whether you
mhm,
can or can't.
mhm,
And so if there are, other reasons that we should have fires culturally or whatever it is, I think that's
mhm.
important to consider as well. So,
Okay. I think that's pretty much I have. I think you talked about all the topics, and I really appreciate your time. It was very interesting. It was very good, stimulating conversation. I just want to thank you once again for your time and joining Namaste Debate.
no problem, Manny. Thank you for the invitation. I encourage all your viewers and listeners to, get involved in politics. It doesn't matter what stripe it is. It's important that you're part of the system and that you communicate what your concerns and priorities are. Because if you don't, someone else will do it for you, and you might not agree with it. So,
Thank you. Yeah,
all
I agree with that. Thanks for
right,
joining Namaste Debate. Thank you. Take care.
take it.